Hello, it's Abrar Hussain from the Department of Epidemiology and Public Health, University of Veterinary and Animal Sciences, Lahore, Pakistan. I'm going to present my work through a poster which entitled as a knowledge, attitude and practices of veterinary professional about rabies, management and control in Pakistan in One Health context. Introducing the rabies, how disastrous that disease is. Canine rabies causes almost 59,000 deaths annually. 1.4 billion lives are at risk in endemic areas. Pakistan also has a very high rate of rabies cases, almost 6,000 cases annually reported. And why we just targeted the veterinary professional and conducted the CAP survey regarding that? Because the most concerned person about the rabies management and control is the veterinarian. So our objective was to assess them, their knowledge, attitude and practices about the management of rabies in animals, and identifying the veterinarian's role regarding rabies and respective loopholes, identify that loopholes under the One Health context, and assessing the role of veterinary professional, creating the campaigns, spreading awareness in the community, especially the livestock and the pet owners. How we conducted that study? We just got the data, first of all, from the Pakistan Bureau of Statistics, according to which there are total 14,591 veterinarians that are registered with the Pakistan Veterinary and Veterinary Medical Council. And from these veterinarians, we selected 375 veterinarians through the coordination of the authors from the different provinces on the basis of population distribution, and we collected the data through the structured questionnaire. And questionnaire were filled through the face-to-face interviews after taking ethical consent from them. From that study, the results we got, as you can see here, the surveyed veterinarians out of 375, 56.3% were said they are exposed to dog bite at least once in their lifetime. And the alarming figure that we got is, you can see here in the pie graph, that 49% of the veterinarians were not vaccinated. That's a very alarming figure. Like, they are more prone to, they got the more probability for the exposure of the dog bite, but the 49% of them were not vaccinated. And the reason they gave being about not being vaccinated, one of that major reason was, you can see in the third bar graph, that the human rabies vaccine was not affordable or accessible to them. You can say 35.7% were saying that vaccine was not pretty much accessible for them, and that is also an alarming figure. So the usual behavior of the veterinarians regarding the general treatment to the dogs or the clients they got for the usual treatments, daily or routine treatment of the dogs. So 43.2% did not recommend the pet owners about the vaccination against the rabies during the usual treatment or the routine checkups of their own dogs. So that is again a big figure that they must be covered up within their attitude. And regarding the best control measures that should be taken for the controlling of the and management of the rabies, the 74% considered the controlling of dog population, and 94.6% considered the vaccination of the dogs, and the campaigns of the dog vaccination are the most effective way for the controlling and management of the rabies. You can see here in the last two bars, like 94.7% were saying the vaccination of the dog in the most effective way to control rabies, and controlling of dog population is the most effective way of controlling rabies. 74.4% of the veterinarians are saying these. For a wide portion of the bar are showing the agreement, they are agreed to the statement that was, I can say, given below. So from these results, just jumping to our conclusion, our conclusive point, that studies highlighting the deficiencies in the attitude, like during their routine checkup of asking about the vaccination status of their dog. In their case management, lacking the One Health approach, in our society, there must be the One Health approach that must include the vaccination of the pets, along with the vaccination of human, to creating the to boosting the immunity level from the both sides, and the creating the awareness campaign that will significantly reduce the burden of the rabies. And there must be some campaigns through the government authorities for the vaccination of the veterinarians, at least that veterinarians who are most prone to the dog bite exposure, so they just boost up their immunity level against rabies. So these are like the approaches that must be followed regarding One Health context to reduce the burden of disease in developing country like Pakistan, to reduce the life losses that we are getting per year. So that's all from my side. I thanks all the participants, all the veterinarians who participated in that study, and the authors who coordinated during the data collection. And that's all from my side. If you have any question, please don't hesitate to ask me here. My Twitter handle is given below, and my email is given there in contact portion. And thank you very much.